Hello once again. The main topic of today's video is going to be about the rapid test or the fast test that detects COVID-19 that everybody has been talking about, especially in South America. What is it about? Well, is it worth it? How does it work? What does it mean when I get a positive result? A negative result. So this video is just going to clear some of the points that you may have some doubts. How to explain, especially to the general population of COVID-19 and to the primary health workers. We know everybody knows that we're actually in a war against this virus. So this new test that has been used like in most of all the South American countries, for example here in Peru, they are using this as well as the molecular test. But what is it about? I guess at this point everybody has heard about the molecular test, like the PCR. In fact, in other words, for everybody to understand, the PCR test, the molecular test, can detect the virus in our body, inside our body, but detects just the virus. In that way, if you get a positive or reactive result from the PCR test, it means that you are infected with the virus because they found some part of the virus inside your body. But what about this new test that is not actually really new, but it's been used here for around 2 weeks in Peru, I guess, or 1 week, I don't know exactly. But what is it about? So as I'm telling you, the first test, the PCR test that detects the virus inside our body, usually the results can give you for an average of 3 days. So they take you the test today, but the results are going to be available only after 3 days. That means that there is a higher risk that those people or that person who doesn't know the results can easily spread the virus somewhere else without knowing that it's infected. But with this rapid test, the fast test of COVID-19, you can take the sample, in this case a blood sample, and you can get the results for about 15 minutes, 10 minutes after you have been tested. So how does it work? This is the war zone, okay? The virus, a huge amount of viruses are coming. So what are the first soldiers of our body that fight? The first ones that appear are what we call the immunoglobulin or IgM. The IgM are the first soldiers that attacks. They are going to attack the virus on the very first time. But once these soldiers, let's say, they have been attacking them, working hard a lot, then we have some other soldiers that are going to support the first ones, which are called the IgG. These ones are like in a reserve place, in a safe place, because there has to be a period where these IgM are going to fight against the virus, and after that period, then the IgG soldiers will appear. So what the rapid test COVID-19 does is that this test does not detect the virus itself. The rapid test detects our soldiers that appear against this virus. But of course, as I told you, it's going to depend of the period of time. The first ones that will appear will be the IgM and then the IgG. But this test, of course, according to what I have explained, has its advantages and disadvantages. So just to keep the idea, what this rapid test is going to test are the IgM or the IgG. The rapid test does not detect the virus. The rapid test detects our soldiers, our antibodies, what we call. Later on, it's going to detect the IgM, depending on the period of time that the patient or that the person is being tested. And of course, the PCR molecular test is going to detect the virus itself. Here we have one of the most important things to understand about this. If the person has the first infection, and we're going to count the day 0, which is going to be the day that person is going to start feeling the symptoms, coughing, sneezing, the headaches, and the breathing. It's going to be very difficult for that person. So let's say that the day 0 is going to be the day where the symptoms appear. So there is a period of time from the infection, the first contact with the virus, until the clinical symptoms appear, which is called the incubation day, which is around, now we know, for around 14 days. Okay? So once we have the clinical symptoms, until 7 days after that, usually, but not always, our first soldiers, the IgM, will appear. Before that period of time, there won't be soldiers, so the rapid test won't detect any of these soldiers. As a result, it will be a non-reactive or a negative test. Okay? Then, it's been a week after you have the first symptoms. And since the day 7, the second soldiers are going to appear, which are the IgG. How many days? In here, and as some other studies have shown, that since the 7th day usually can the IgG appear, along with the IgM, of course, but with a higher number of detecting the IgG. Some other studies have shown that the antibodies, these soldiers that I have explained before, can appear since the 10th day after the symptoms appear, not just a week. So there is an average of 7th or the 10th day after the clinical symptoms where those soldiers are going to appear. Before that, the rapid test will finally give a negative result or a reactive result. So that's let's say the conflict, the dangerous or the disadvantage of the rapid test. Whereas the molecular test, no matter the period of time, if you have been tested with a molecular test and it's positive, it means that you are infected. So those are the differences between the molecular test and the rapid test. It's very important to know and how to interpret the results. If I get a rapid test today and it is negative, it doesn't necessarily mean that I am not infected. It could mean that I am infected, but I am in this period of time where my soldiers for the rapid test won't appear yet until 1 week later or 10 days later. If I am detected positive in the rapid test, doesn't mean that I am currently infected as well. It means that I have been infected, or that I have had the virus, but what the rapid test detects are my antibodies, my soldiers, not the virus. But it has been a previous contact. It detects that I have been infected before. So rapid test positive means that I have been infected before. How many days before depends on the results of the rapid test. If the rapid test shows IgG, like a higher amount of IgG, so it's going to be positive for IgG, it means that it has been a long period of time that I have infected. If the rapid test detects the IgM, it would mean that maybe a week ago or kind of 10 days ago, I have been infected. That's why my soldiers are still appearing in the rapid test. Alright? So it's very important to know about this. All this information I have show and share are in the Pan American Health Organization webpage. You can check and talk about the samples that are required. For the respiratory samples, means the swabs of nose and oropharynx swabs, are usually for the molecular test, the test that detects the virus itself. Alright, but for the rapid test, we have, and this article mentions other sample types, which basically are the blood tests for the rapid test. Here we know that the molecular, everything that I told you is actually written down in this article. It's more technical, with more technical words, of course. But molecular methods detects the virus itself, one part of the virus. In this case, the RNA, the nucleic acid. And what about the molecular? If you test positive, well, it would definitely mean that you are infected, because the molecular tests detected the virus in your body. But what if it says negative? If you have a negative result in the molecular test, could mean that you are not infected, but also you have to take in consideration, especially health workers, there is a lower risk of a negative result that is associated with poor sample quality or failed sample extraction, or maybe the patient was not shedding sufficient amounts of virus. Alright, maybe, could happen. We have to take in consideration that. That's why everybody needs to be eaten and needs to avoid going outside. You need to respect the quarantine on your own. The serological methods, which is the serological test, also known as the rapid test here in South America and everywhere else, which is going to detect the antibodies, our soldiers, not the virus. And depending on the time they appear, it should have a correct interpretation. Okay? Less than 40% of patients have detectable antibodies during the first 6 and 7 days. So usually, in order to have a positive result, we need to take these tests 1 week or 10 days after the symptoms appear. We have some results that are more technical, like whereas it's positive or reactive, we're going to have some very colored lines in the test, but it has to be really clear for simple reading. This especially is for health workers. The negative test and invalid test, which doesn't mean that it's negative. So the health worker that is taking the test should know absolutely how this works. So this is just for a reference for everybody to know that we have to know all these things, technical things, in order to read correctly. And thank you so much. If this is helpful for you, please share, and don't forget to subscribe. And if you haven't seen the first videos about transmission, how do you get the COVID-19 and how does the COVID-19 affects our body, I'm going to leave the links down below so you can check it out. And for more information, you have this link.